I'm Dr. Margaret Lafferty. I'm live here from the Hot Topics in Neonatology meeting in Washington, D.C. And I'm here with Dr. Howard Panitch from Philadelphia, the Children's Hospital of Philadelphia. And we are here to talk, to discuss his talk about pulmonary outcomes in babies with congenital diaphragmatic hernia. So welcome, Dr. Panitch.
Thanks, Margaret.
So, Dr. Panitch, what would you say is the summary, a good summary of your talk?
So we know that babies with congenital diaphragmatic hernia often have lung hypoplasia, and some will also have pulmonary hypertension. The degree of lung hypoplasia can influence their survival, as can pulmonary hypertension in terms of leaving the NICU, but we also know that the degree of pulmonary impairment as reflected in the kind of therapies the kids need can also be predictors of their longer term outcome. So for instance, those infants who require therapies at 30 days of age in the NICU for respiratory support like supplemental oxygen or positive pressure, at the time at 1 year are much more likely to require therapies for respiratory disease like inhaled medications, inhaled steroids, diuretics, even supplemental oxygen. And the same is true when they're 5 years of age. We know that children who have worse disease also tend to be more likely to be hospitalized from a wheezing illness in the first couple of years of life. When we look at a large series that looked at the size of the hernia, we know that those kids who had worse disease as depicted by the size of their hernia are much more likely to leave the NICU requiring therapies for their respiratory status as well.
What is the one major take-home point you'd like people to take home from your talk?
So we know that lung function in the large group of children, even through adolescence and young adulthood, with a history of a congenital diaphragmatic hernia, when measured carefully, is not normal. Those children probably don't have what we call compensatory lung growth, but clinically they do pretty well. So while they may have some recurrent episodes of wheezing, especially when they're younger, that gets better as they get older. Their ability to exercise seems to be pretty good, and their sense of their own quality of life and physical limitation is no different from that of a healthy population.
Okay, great. Dr. Panitch, where would you say we go from here with congenital diaphragmatic hernia?
Well, we still need to understand better some of the things that cause the different degrees of lung hypoplasia and pulmonary hypertension. There are new therapies that target the sickest babies prenatally, and we don't understand yet how that will affect their long-term outcome. So I think there's still lots to be learned, and if there are ways that we can tweak the system to help with lung growth, we still have to discover that as well.
Sounds good. Thanks very much for being here, Dr. Panitch. That's a wrap from the Hot Topics in Neonatology conference here in Washington, D.C.